Welcome back. This is Basis of Nephrology, Fluids Part 2. I saved your seat, glad you came back. So, people often ask me, Dr. Kaiser, how can you tell if someone is wet or dry? Is this by looking at them, by touching them, by smelling them? Any of the above? All of the above? None of the above. Well, as a nephrologist, we can use lab tests, but the first thing you do is you talk to the patient. Talking is an art that is lost in some people, but in the world of texting and all those other high-tech gadgets, talking is the best thing you can do because that's how you get accurate history, accurate information. For example, look at the body as a closed system. Just like NASCAR, everything goes round and round. Or a circle, round and round. Triangle, trapezoid, that's cool, but keep it simple, circle. So therefore, if your body is a circle, whatever is added to it is added to the circle. Whatever is taken away from it comes from the circle. Therefore, if you're dry, it's because you've been vomiting. You're vomiting out fluid, diarrhea, taking fluid away. You're sweating too much, taking too much fluid away. So, examples of being dry, nausea, because you're not wanting to eat when you're nauseous. Nausea, vomiting, diarrhea, sweating too much, no appetite. All of those are examples of being dry. If you want a water pill, peeing too much, you're dry. Now let's look at what wet is. Same closed system. If you're wet, you're adding too much fluid. For example, if you have congestive heart failure, your heart's not pumping quite accurately or efficiently enough. So therefore, fluid's getting backed up. So now you're wet. So now you need a diuretic. Or say, for example, you have cirrhosis of the liver, which can be wet and dry because your vessels are small, because you're dry in your vessels, but you have fluid that makes you swell. So therefore, you can be wet and dry. But just for simplicity's sake, just look at wet versus dry. If you're wet, volume overloaded, congestive heart failure, get rid of the fluid, and there you go. That's the best way, the easiest way to explain wet versus dry. Now with that being said, all swelling is not fluid. Someone can have malnutrition, for example, third world countries, little kids with the big stomachs. That's not fluid, that's just malnutrition. So you don't want to get rid of fluids if someone's malnutrition. All leg swelling, or as we call it in medical world, edema, all edema is not fluid. It could be low protein such as medication side effects or malnutrition or other things. So don't think that all swelling is fluid because it's not. The best way to figure this out is to get some urine tests, look at the blood pressure, but I can go into more details in the next lecture. But just know that if you're dry, it's because you're losing fluid, as in too much fluid, such as nausea, vomiting, diarrhea, peeing too much, sweating too much, playing too much football, you're dry. Congestive heart failure, too much fluid not going in the right places, you're wet. Stay tuned for the next lecture.